Doctors of Reddit, who's the dumbest patient you've ever had? Ophthalmologist here. Patients, I wasn't getting better, so I asked if he's using his drops in the correct eye. He wasn't. He argued that his right eye is really his left eye because he throws a ball with his left hand. I argued right versus left with him for a good 5 minutes before I gave up. He won the argument. I've had 2 patients who stare at the sun. They both said it's like stargazing because the sun is technically a star. I had a blind patient who was still riding a motorcycle. He rode into a house and had to give up his motorcycle. Next story. I thought this only happened in TV shows, but one of my sister's friends is a doctor and told us about a teenage girl that came to the ER with abdominal pain. Yes, this is going where you think it's going. When asked, she swore up and down that she couldn't possibly be pregnant. They ran the usual tests, and, wouldn't you know it, the girl was pregnant. She could not believe it, total denial, but she did not deny having sex with her boyfriend, so the doctor, my sister's friend, asked her what birth control they used. Apples. She ate an apple after having sex with him. Next story. My mom worked at a major hospital and heard the story of a guy who called the emergency line saying that he'd accidentally stabbed himself in the torso with a knife while cutting something. Their first piece of advice was to not remove the knife, to which he replied, "What do I do if I did remove it?" And they gave him instructions. When the ambulance arrived, they found the man with the knife in his torso. Yep, he put it back in. Next story. Worked at an urgent care for some time. Late teens patient, F, comes in with mother for abdominal pain. I have a student doing the initial history and exam. Swears there is no chance of pregnancy. But is sexual active with so. But swears no penetrative sex. Well, we get the urine results back. She's pregnant. Student goes back in, asks the mother to step out, and has to have the most awkward conversation with this patient detailing what sex was. Well, it turns out she was indeed not having penetrative sex with a penis. The happy couple would fool around and then use the male sperm as lube for her to get fingered. They thought that to get pregnant, the penis had to fall off and become the new baby. Next story. This doesn't exactly fit the criteria, but it's close. Not a doctor, I'm a nurse. And not a patient, family members. Back when I still worked in the ICU, I had a family come in during visitation to see their loved one carrying one of those plastic containers from a grocery store bakery with half a dozen cupcakes inside. Not unusual, families would bring us food all the time and it was incredibly nice and we always appreciated it. Nope. I walked into the room to update them on the patient and we talked about it also being her birthday that day. They gestured toward the cupcakes and said that's why they had the cupcakes with them. I thought that was really sweet, they were going to celebrate her birthday with her even though she was in the ICU. Then they hand me the container and look at me expectantly. I look back, unsure of what my next move was supposed to be. Aren't you going to feed them to her? This woman was on a ventilator and on forced sedation. It took me an embarrassingly long time to explain to these people why she couldn't eat while she was unconscious with a breathing tube in. Nice folks, not terribly bright. Next story. In training, had a surgical patient getting toes amputated because of diabetes. All shift he kept getting insulin but his sugars wouldn't come down. Just didn't make sense. Eventually found a lot of candy under his pillow. Not sure if it's dumb or just sad. Maybe bit of both. Next story. Radiology told me about handing orange earplugs to a patient for an MRI and he popped them in his mouth and swallowed them. Next story. I discharged a Russian patient after he had been hospitalized for alcohol-induced liver damage. As I was getting him out the door, I impressed upon him the importance of avoiding alcohol and he asked me, sincerely, if vodka was considered alcohol. Next story. Not a doctor, but I had a lady come in complaining that she couldn't afford her medications anymore because she was smoking half an ounce of weed a day. Not a gram, but literally spending $200 per day on weed. I also had a 20-year-old guy who came in because he was feeling sick but neglected to tell us that his penis was rotting off and necrotic. We didn't know until his wife came and asked us about it a few days later. Next story. The other day an established patient came in for an emergency dental visit because all of his teeth were hurting worse and worse and worse, to the point where he could barely touch them with a toothbrush. The pain started a few weeks after he had started swishing with peroxide every day. He had decided he wanted less bacteria in his mouth, and he decided that swishing with peroxide would be the best way to do this. But now, every time he used the peroxide, his teeth became severely sensitive and painful to touch. Me, wondering how to gently break the news to this otherwise bright guy that he was being dumb. So, have you tried not swishing with peroxide? Him, well, no. Me, well, try that. What ya know, problem solved. This is certainly not my dumbest patient encounter, but it was recent and the only one that comes to mind at the moment. Next story. Not a doctor but was an administrator at an ophthalmology clinic. A patient had to be prescribed some pills before his eye surgery. He returns 5 minutes after his consultation super concerned, as he didn't know how he was going to get the pills into his eyes. Our nurse suggested that he try swallowing them. Another patient had chronic dry eyes that he was seeing one of our doctors for and one day called for an emergency appointment as his eyes were in pain. Apparently he had heard of honey being used in eye drops to help with dry eyes, so the man put straight honey onto his eyes. Next story. Not a doctor, but cath lab tech. Had a patient's wife sneak him a sandwich before his heart cath, not supposed to eat before since we used some sedation, and they didn't tell any of us despite many times confirming he did not have any food or drink. The patient then threw up and aspirated during the procedure. Ended the rest of his week in the ICU and almost died because his wife snuck him food. Please listen to your healthcare provider's instructions before procedures. These rules aren't in place to torture you, but to keep you safe. Next story. I'm a PhD clinical psychologist, so not a physician. Patient came in for an emergency appointment. Usually these are folks who are suicidal, recently assaulted, manic or in psychosis. He filled out all our paperwork, so many questions about mental health history, and sat in our waiting room. I can't tell you how clearly this is a psychological services clinic. Finally, he gets back to my room, sits down, and pulls up his pant leg. Starts taking off his shoe. My man had ankle pain. Me, I'm really sorry you have been waiting for so long, but unless you want to talk about how your ankle pain is making you feel, there isn't anything I can do. It took a little convincing that I wasn't holding out on him. No, I wouldn't just take a quick look at it. He was baffled and kept saying, "But you're a doctor." I'm not convinced I successfully explained the difference between a psychologist and a physician. I don't even think he was drug seeking. He was freshly 18 and not the brightest bulb. He eventually limped off to the nearest urgent care. Poor kid. Hope he's okay out there. Next story. I have a few good ones. My sister's a doctor and she saw a patient and prescribed meds. Asked them to come see her a week later as a follow-up. Patient comes back next week saying that they don't feel better at all. Sister asks to see the meds she prescribed to ensure they got the right ones. Patient says they never picked up the meds because they only wanted meds with organic ingredients, not one full of chemicals. Husband comes in with a set of complaints. Sister proceeded to check him out and find that there was nothing wrong with him. That's when he told her that it's actually his wife who had those symptoms. And he never brought her in to get checked. On top of it, he was pissed that the doctor couldn't just fix his wife without seeing her. I had a PT straight up tell me they were giving and selling their pain medication away to friends. It was their reason for needing frequent refills. Next story. Not a doctor but work in medicine. Shout out to the patient who in one visit, told us that insulin didn't work for her personally and that her diabetes worked different than other people's. Also in the same visit she tortured the poor medical student. She told the medical student that it was her 7-year anniversary, the medical student congratulated her, and then she goes, "It's the 7-year anniversary of the day he left me." Medical student was mortified and I was super annoyed. Like, lady, why? How was the poor medical student supposed to know? Next story. When I worked as a medical assistant in an OB-GYN clinic, a patient called to make an appointment because she needed a fallopian tube. I was so confused, I asked her if she was meant that she wanted to get her tubes tied. No, she said, "I'm trying to get pregnant, so I need to get a fallopian tube." Definitely booked a visit for pregnancy planning education session.